All right. Hello, everyone. Welcome to our webinar, where we will be reviewing everything an ambulatory anesthesiologist should know about potentially cardiotoxic chemotherapies. The topics include how to recognize the signs of cancer therapy-related cardiotoxicity, cardiac preoperative evaluation, and aesthetic implications. For those of you who are not SAMBA members, please consider joining the society as it offers many benefits to the members. You can view a list of membership benefits on your screen now. Please visit our website, www.sambahq.org, to learn more about the benefits of membership. So a few quick housekeeping notes before we get to today's presentation. Please note that this webinar is listen-only mode. As an attendee, your audio and video is off. On the bottom of your screen, you will see two buttons, one that says chat and one that says Q&A. Please use the chat function to chat with the other attendees during the webinar. Please use the Q&A box to place any questions that you have for our presenter today. Dedicated time for Q&A will take place at the end of the presentation, but please submit your questions throughout so that we can prepare to answer. SAMBA is on Twitter, Facebook, and LinkedIn. Connect with us on social media to stay up to date with all things SAMBA. Now on to introduction. So my name is Dr. Kara Barnett. I'm the Director of Anesthesia Services at Memorial Sloan Kettering Cancer Center at our Monmouth Regional Site. In addition to presenting, I will also be moderating this webinar. At this time, I'd also like to introduce tonight's main speaker, Dr. Stephanie Feldman. Dr. Feldman is a cardio-oncology fellow within the Division of Cardiology at Memorial Sloan Kettering Cancer Center. She has been with MSK since July 2020 after completing her fellowship in general cardiology at Boston Medical Center, Boston University School of Medicine. She has clinical and research interests in multimodality cardiac imaging, primary and secondary prevention of cardiovascular disease, venous thromboembolism, and medical education. As a cardio-oncology fellow, she takes care of patients with cardiovascular disease, cardiac side effects of cancer therapies, and assists with preoperative risk stratification optimization in the inpatient, outpatient settings at MSK main campus. All right, so let's get started. I'm just going to pull up the slide. Just one moment. Okay, great. Okay, so thanks again for joining us. We're really excited to present. It's not just anthracyclines anymore, what every ambulatory anesthesiologist should know about cancer treatment toxicity. Next slide. And we have no disclosures to report tonight. So our objectives in our talk today, we are going to identify potentially cardiotoxic chemotherapies in the preoperative evaluation. We will discuss what chemotherapies are potentially cardiotoxic and how to recognize the signs of cardiotoxicity, and what the pre-op and peri-procedural implications are based on the patient's previous cancer treatment history. So we are here because of this case. This is what made me very interested in the topic of chemotherapy and cardiotoxicity implications for anesthesia. We also published it as a case report in ANA practice. So during my training, the main chemotherapy agents that I was taught to be aware of were anthracyclines and bleomycin. But now there are just so many more chemotherapies and so many more things that we should be aware of as anesthesiologists. So as I mentioned in my introduction, I'm Director of Anesthesia Services at MSK's Monmouth Regional Site. It's our freestanding ambulatory surgical center. It's about 1.5 to 2 hour drive from our main hospital in Manhattan, and we have a lot of different types of outpatient procedures, and Medipore placement by interventional radiology is one of our most commonly performed procedure types. So I think we just have to go ahead, Stephanie. All right, there we go. So it's a 77-year-old male. He's an ASA3. He came to our regional site for a Medipore placement with sedation. He had a history of lung cancer, hypertension, DVT, and he was undergoing treatment for his lung cancer when he came in with pembrolizumab, otherwise known as Pembro. He denied any cardiac symptoms, said he could walk up a flight of stairs without stopping. And about 3 months prior before treatment, he had a normal EKG. And I'll give you a picture of that to take a look at. And here it is, nice, normal, nothing significant. All right. So in the IR suite, we placed him on the anesthesia monitors. He's a little tachycardic in the 110s. Saw quite a bit of PACs and PVCs. And so we called cardiology at our main campus just to take a look, and they can tap into our monitors remotely. And they said it looked fine, it's just some PACs and PVCs. So we went ahead, and typically we give propofol for these types of cases. So we started some propofol, and we ended up stopping it just again, his EKG looked a little funnier. We called cardiology a second time, and the patient woke up in the meanwhile, didn't have any cardiac complaints, and it looked okay. So we proceeded, and this time we gave some Versed and some fentanyl. During the case, he also received some Esmol and phenylephrine. So he had no complaints when he got to the PACU, but I decided to get a post procedure EKG just because, again, it looked a little weird in the OR.